The ruling is a big setback for the Biden administration, urging people to get vaccinated as Omicron, the new variant, threatens the U.S. and other countries around the world. Now, the World Health Organization issued a new travel guidance saying anyone over the age of 60 or at risk of developing severe COVID symptoms should postpone international travel. Now, cases of Omicron have been detected in 20 countries since it was first reported in South Africa last week. So far, health leaders say they have no evidence of Omicron here in the States, but experts all agree it's a matter of time before it gets here.
10 Tampa Bay's Angelina Salcido spoke to an expert about what may happen if travelers bring the variant to the U.S.
Right now, anyone who is not from the U.S. but is trying to come here from 8 South African countries is banned. But scientists say people are still bringing Omicron here. So do travel bans actually work? Doctors say it depends.
We do all we can to stop the variants.
Despite Omicron likely being in the U.S. already, mathematical modeler Dr. Edwin Michael says making a split decision on travel restrictions buys the nation time.
You want to prevent a large entry, or spread. Is it very effective? I think, we should err, on the side of caution.
More than 200 cases of this new variant have turned up in 20 countries so far. While the U.S. races to step up its COVID-19 surveillance system, Dr. Michael says the way the virus spreads will depend on its transmissibility, how long our immunity from vaccines lasts, and if people get their booster shot.
If it's like 10% more transmissible than Delta, then that's not going to make a big impact. But if it gets to 25% and 50%, then we have to be careful.
Take a deeper dive into the data for Florida. Forecasts show a fourth wave of cases if vaccine immunity wanes and Omicron is more transmissible.
We're not out of the woods.
So it's a waiting game, and travel will have an impact.
Florida will be high risk.
While the Biden administration waits to learn more about Omicron, they say they will not be changing international flight restrictions anytime soon. The best thing we can do, though, is get vaccinated or boosted.
The CDC is urging all adults to get a booster either 6 months after their final dose of Pfizer or Moderna or 2 months after the Johnson & Johnson shot.